Good evening, ladies and gentlemen. Thank you all for joining us. Today, I am here to speak with you about an ongoing public health situation that is affecting not only human health, but also animal health and the way we interact with our environment. At the end of 2019, an unusual cluster of pneumonia cases linked to a wholesale seafood market was detected. Initially, it was suspected that these cases were due to direct contact with live animals or raw animal products within the market. Such environments can provide the ideal conditions for novel pathogens to jump from animals to humans. On January 7th, 2020, health officials have identified a novel coronavirus as the cause of the respiratory illnesses. As the investigation progresses, it has become clear that transmission is no longer limited to direct contact with market animals and animal products. Evidence is now pointing toward person-to-person transmission, which provides a better understanding of potential risks associated with the situation. This highlights how quickly new pathogens can emerge and how rapidly they can spread. Over the following months, the numbers have escalated. The local outbreak has evolved into global health concern. By January 30th, there were over 9,000 confirmed cases in at least 21 countries. This trend continues with more cases being confirmed in even more countries. By July, there are millions of confirmed cases and a significant number of deaths. As the chief veterinary officer, I am here because this situation shows the overwhelming importance of a One Health approach, which is an integrated effort that connects human health, animal health, and the environment. We work with medical doctors, epidemiologists, ecologists, wildlife experts, food safety authorities, and community leaders to provide widespread care for all. Many diseases that we face today have zoonotic origins, in that they begin in animals and cross over to humans. This isn't limited to exotic wildlife, but also includes livestock, companion animals, and the broader ecosystems. We, as veterinarians, work together across sectors to monitor emerging threats, implement surveillance, and develop early warning systems. We focus not only on treating sick animals, but we also actively work toward preventing the next global health crisis. Here are a few steps that we as veterinarians take to protect both human and animal health. We routinely inspect and perform health checks on animals in markets, farms, and processing facilities to ensure hygienic practices and to detect early signs of emerging disease. We do not only focus on the animals used in food, we also closely monitor all other domestic and wild animals for any signs of disease, especially if they come in close contact with humans. We monitor the movement of animals and animal products across local, regional, and international borders to prevent the introduction of diseases into new regions. We provide guidance on responsible animal handling, food safety, and biosecurity practices to farmers, traders, veterinarians, and the public. We work with scientists, epidemiologists to investigate the origins of emerging diseases, study transmission pathways, and contribute to the vaccine and treatment research. We work with policyholders on creating strategies to mitigate risk and to create emergency preparedness plans. As members of the public, you play a vital role, being informed, practicing good hygiene, especially when handling food or animals, and staying aware of health advisories are all essential to help mitigate risks and spread. Some steps that you can take as a pet owner, farmer, hunter, or even a concerned citizen are reporting any unusual animal illnesses or deaths to the appropriate veterinary authorities, practice good hygiene when handling animals or animal products, buying products from reputable sources, and handling the food properly and safely at home. Try to avoid contact with animals, especially in unregulated markets or trade settings. Stay informed with trustworthy sources and avoid spreading misinformation. While I know that the statistics are overwhelming, the strength of our response relies not only on the expertise of our health professionals, but also on the cooperation of every individual of the public. We are not always able to predict what the next emerging threat might be, but we can prepare. Using information gathered from the ongoing situation and previous situations like it, we can work toward building stronger disease surveillance systems, invest in better animal health infrastructures, and support scientific research into vaccines and treatment. We, as veterinarians, aim to not only treat sick animals, but also protect the human-animal interaction and prevent such crises before they arise. In conclusion, I urge everyone to recognize how deeply we as humans are intertwined with animals and the environment around us. We must protect the health of the animals and our environment in order to effectively protect the health of humans. Thank you for your time. Stay safe and informed.